Great. So let's apply some of that anatomy that we've just learned to a real case of a 68-year-old gentleman who presents with medial ankle pain, the markers placed in the area of interest. And let's just start with this axial proton density fat suppressed sequence, taking a look to set ourselves up with the anatomy of the posterior tibial tendon, the flexor digitorum, and the flexor hallucis longus tendons. Of course, we have our neurovascular bundle intervening in our posterior tarsal tunnel. Paying attention to our posterior tibial tendon, we're going to take our posterior tibial tendon down, passing the fibers of the deep deltoid, passing the fibers of the superficial deltoid to our location medial to the navicular. Now, once the posterior tibial tendon passes the region of the supromedial band of spring ligament, which this is seen partially here, then the posterior tibial tendon's anatomy will split into two main bundles. One bundle will go to attach at the medial navicular. That's about 2/3 of its tendon will attach there. And then another third will go down and variably attach to the cuneiforms and metatarsal bases. So taking a look at this, you can appreciate that it's slightly blurry as we go down through a standard axial sequence. And before we go to our axial oblique imaging, I just want to show you on sagittal, we'll be taking that posterior tibial tendon down, passing the region of the deltoid ligament to move down towards where we expect greater than 2/3 of that tendon to attached to the medial navicular, or 2/3 of it. Now, one thing that we know about is where is the location of the spring ligament. So the talar head is supported by special calcaneal navicular ligaments, and those are called the spring ligament complex. And there are 3 bands to that. And to see those best, I'm going to load the axial oblique images. So again, just setting ourselves up, we have the talar head, and as we go inferiorly on the talar head, we begin to appreciate the 3 bands of the spring ligament complex. Starting with the reliably seen supromedial band of the spring ligament, we can see that the medial aspect of the talar neck, and even moving inferiorly, the medial aspect of the talar neck more inferiorly, we begin to appreciate its support along the medial side of the talus. So that's your calcaneonavicular supromedial band of spring ligament. And then moving medially, we have that medial plantar oblique bands. And those are seen here slightly stretched, very well seen because of the periligamenous edema and mild sprain. And then, of course, we have our inferior plantar oblique bands. All of these ligaments from the calcaneus to the navicular to support the talar head. And this is very important when we have our normal phase of gait where we have heel strike. There's a large load that's placed on the posterior tibial tendon and the medial ankle. And that allows us to lock the transverse tarsal joint and give stability to this portion of the phase of gait where we're inverting the foot. So having this posterior tibial tendon instability can cause a great deal of dysfunction in our phases of gait, and we'll talk about that again. But looking at the anatomy that we can see here on MRI, again, appreciating that superficial to the posterior tibial tendon, that's your flexor retinaculum, then it's the PT. Then we have that superficial deltoid, the tibial spring, and that's attaching to the sustentaculum talus. Further medially, we're going to see those tibiotalar deep fibers of the deltoid ligament, and you can see that the shorter, deeper fibers and the more sprained, more superficial fibers, and of course the synovitis. Lastly, if we're wondering if there's usually some degree of interdigitation. So here I've loaded up your coronal T1 images, and these are helpful for me to understand because the spring ligament is often sprained chronically, and we'll be looking at the T1 to see obliteration of our fat planes to denote that there's been sprain. So in looking at this case here, and just let me center that for us, we can see the poor definition of the deltoid, the deep fibers. We can see the tibiospring, or part of it, because there is some degree of magic angle. And of course, we can see our flexor retinaculum superficially. Moving down to that area where the supromedial spring ligament attaches to navicular, it's often with fat in a normal situation. But in this case, because it's sprained, we have this interdigitation of the synovitis, the cellular replacement of the fat. So thank you. This has been a great case of a mild sprain of the anteromedial attachment of the supromedial spring ligament, and also a partial interstitial tear of the posterior tibial tendon at its navicular attachment.